presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 18. Chief Complaint. A 25-year-old female presents to the clinic with complaints of chronic joint pain and swelling. History of present illness. The patient reports experiencing joint pain and swelling, which started approximately 6 months ago and has gradually worsened. She notes that the pain is symmetric and affects multiple joints, including the hands, wrist, knees, and ankles. She describes morning stiffness lasting about 30 minutes. She denies fever, rash, or recent infections. She does not have a significant past medical history. She takes over-the-counter pain relievers occasionally. These pain relievers do not require a prescription to buy them. She is not a smoker. She occasionally consumes alcohol. Her mother has rheumatoid arthritis. Physical examination shows BP 120 systolic, 80 diastolic, heart rate 72, respiratory 16, temperature 98.4. When we check for our musculoskeletal region, there is symmetric joint swelling and tenderness noted in the hands, wrists, knees, and ankles. Morning stiffness is also present. Initial differential diagnosis: rheumatoid arthritis, systemic lupus erythematosus, psoriatic arthritis, reactive arthritis, osteoarthritis. Based on this presentation, what do you think is the most likely diagnosis, and what further investigations or management steps would you consider? So, rheumatoid arthritis is an autoimmune disease. One knows that. And there are certain genetic factors that can affect it as well. Systemic lupus erythematosus is basically when the immune system goes on a self-sabotage mode. They attack their own tissues. Psoriatic arthritis is, as the name suggests, people who are suffering from psoriasis develop arthritis itself. Reactive arthritis, as the name suggests, it's a reaction due to any infection. Osteoarthritis is the common arthritis which occurs in old age due to diminished soft tissue present at the bone endings. Some of you might know that psoriatic arthritis would also present with morning stiffness, but in this case, because the family history already has someone with rheumatoid arthritis is a more likely disease to occur. What are the investigations that we'll do? We'll check for the rheumatoid factor and anti-cyclic citrullinated peptide, which is anti-CCP antibodies. What happens is the anti-CCP antibodies are elevated in most of the cases even before the arthritis occurs. We check for a complete blood count to see for anemia and leukocytosis. We'll check for the ESR and C-reactive protein to see for inflammation, of course. We know by erythrocyte sedimentation rate, because in inflammation the erythrocytes tend to clump up together because the iron reserves tend to get used up. Common imaging, the X-ray of the affected joints so that we could check out for the joint erosions, and we'll do a bone scan or MRI. Check for any other inflammation. Perform thyroid function test because thyroid is responsible for calcium homeostasis and stabilization of the bone. We'll do a TSH and parathyroid test to check for calcium homeostasis. We'll analyze the synovial fluid to see the presence of any ureate crystals to rule out gout or if any infection is present there. For management, we'll provide them with DMARDs, which is basically disease-modifying anti-rheumatic drugs. The progress could delay it as much as we want. We need to start it as early as we could. Example would be methotrexate. We will provide them with non-steroidal anti-inflammatory drugs for symptomatic pain relief and inflammation. Provide them with corticosteroids. Now we are providing them with non-steroidal drugs at one place, and at the other place we are providing with corticosteroids. We are giving them corticosteroids for short-term use whenever there is like acute pain, it's unbearable. Long-term use could increase the dosage of corticosteroids for the same results. That's why steroids should not be given in a long-term manner. Therapy would be recommended. It could maintain the joint function. We'll schedule a regular follow-up so that we could monitor the disease activity, we could check the prognosis, and we could adjust the therapy as needed. Hope you like the case study of today. You can come back whenever you want to submit. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve cases. Thanks for watching. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.